Okay, if you look right here, you're gonna. Oh, that was fun. Thank you. Okay. All right. First of all, if you're wanting to find which side is which, okay, this one was chopped a little short, so it's not as easy. With most of the hearts that have a little bit less chopped away, you're going to see the vessels on the anterior surface. Most of the vessels are not opening out towards the surface towards you. The vessels are either going up or out towards the back. So if you're looking here and you see none of the vessels opening towards you, that's one clue that you're looking at the anterior. The other is the anterior interventricular sulcus, which is, is fat-filled and covered with a membrane here. It traces, it's a nice long diagonal one typically. If you look on the posterior surface, you have a posterior interventricular sulcus, but it's much less pronounced, shorter, squatty, not as well marked. Besides, you have vessels that are open towards the back. So this one looks like we can pretty much tell that this is anterior. And if we flip this open here, again you can tell right from left. Take a look at this chamber here.
It's more thicker.
What's this chamber? It's atrium or ventricle?
Ventricle.
Ventricle. Now if we open this up a little bit more, oh sorry, I don't want it falling all the way out. So this is going to be one of the ventricles. Here's going to be the other ventricles, and this thing dividing in between?
Septum.
It's a septum. In this case, it is an interventricular septum. Yeah. And this is so this is ventricle and ventricle here. What might this ventricle be? Right or left?
Right.
Ooh, I don't know how to break this to you, but it's the right. It is. Because the thinner layer here versus the thinner layer here, what layer do we call that? What's the name for that layer?
Right.
Ooh, close.
Myocardium.
Oh, right. Myocardium, the actual muscle layer. The epicardium is this thin layer out here. What are the names is the epicardium known as? The visceral layer of the pericardium. Okay, we have the endocardium. Yeah, endometrium's a different system. Okay. Now in here we have the big fat section here, the papillary muscle, connected to the chordae tendineae, which go up against the flap or cusp. Now this one, since I'm on this side, I have, how many cusps am I going to be looking at? Bicuspid. Remember, you try before you buy. If you follow the flow of blood through the heart, you go through the tricuspid before you go through the bicuspid. Try before you buy. Okay. So this is going to be the bicuspid, left atrioventricular or mitral valve. Has 3 names. Okay, and these are the chordae tendineae here that are attached down to the papillary muscle. You see the little wrinkled surface here? That's going to be the trabecular carne. Come over here, and we have much of the same as far as the chordae tendineae coming up to, in this case, the tricuspid, because we're on the right side. And past this valve up into here, this space up in here, this hollow space chamber is what?
Right atrium.
Right atrium, exactly correct. And the chamber that we're going up into in here is past, it's going to be left atrium, exactly correct. Okay, let's see, we have, let's get the vessels here. Okay, we talked about the 2 sulci. Okay, this is, okay. Take a look here. What's this little flap? This little hanging over flap is the
auricle.
Right, and we have, auricle delphi. I know it's my favorite joke, but if we bring it up through here, you notice that if we go out from the left ventricle, if we go out here and follow it out, it goes past another valve. Going out this way, that's the aortic semilunar, passing out the aorta. Now, what's this first thing? Oh, I thought that was the vessel. It's not. This is. Here we go. Do you see, if this is a pointed one, here's the aorta going into the aortic arch, but do you see this first branch coming off? It could be the brachiocephalic.
Do we need to know that one?
Yes.
A brachiocephalic trunk.
Yeah, that is. That trunk will split later into the right common carotid and the right subclavian, but and in the cat it would also include the left subclavian, but not in human. Okay, this is, so we see that one here. Oh, it looks like you have the brachiocephalic here and possibly the left subclavian here. It's hard to tell. They chopped it a little early. Okay, now what about this one here? What's this one in front of it? A big one, almost as big as the aorta. Pulmonary, part of the pulmonary trunk. And if you look at the angle, it's going to be coming down into the right ventricle, exactly. And if we turn this over here, I'm sorry, you do want some heart, right? Heart juice. Okay, let's see. Take a look at it from the back. This one's, see, you've chopped away part of the left atrium here. In fact, the part that has the pulmonary arteries coming back and veins coming back in are chopped away, and looks like same thing for the right atrium as far as the vena cava coming in. We're not going to be able to see that very well in this one, but the aorta and the pulmonary trunk are easy enough to tell, because which one's going to be the most anterior of the two?
Pulmonary trunk.
Pulmonary trunk, absolutely. And the aorta, so all I got to determine is front and back, left and right, and pretty much it maps itself out from there, doesn't it?
Yeah.
And if it's like this, and you see a nice long anterior interventricular sulcus, and none of the vessels coming towards it, then you know where you're at. If they open it up, then you get to see the myocardium, and that will spell it out for you.
Can you point out the myo and epi again? I'm kind of confused with that.
Okay, the myocardium. Myo is muscle. The big thick muscle is myocardium. The outer part's epicardium. The inner membrane layer is going to be endocardium. And also look at the context of the question for telling you whether they want a membrane layer or whether they want the papillary, the bulge muscle there, or whether they want the chamber. Typically, they're pretty good about.
Can you do the eye?